With the winter coming, it's once again time for some advice about flu season. That means advice about everything from prevention to speeding up recovery. To share that advice is our guest, the founder of the personalized medical practice Redcross Concierge. We'd like to welcome Dr. Ken Redcross. Thank you very much for being
here. Thank you, Chris. It's wonderful to be with you here today.
Doctor, the first thing I would be asking myself is that I've got this or that symptom, but is it really necessarily the flu? I mean, help us figure that out.
Yeah, that's a tough one because a flu and a cold tend to have similar symptoms, right? We talk about nausea, vomiting, some fatigue. I usually look out for those terrible body aches. When someone calls me and says, Doc, I just feel like I've been hit by a Mack truck, that tends to kind of get me going to think maybe we're dealing with the flu and not the typical regular bug that we all get from time to time.
Of course, the other thing about people out there is that there are still some mixed opinions about whether you should get a shot.
Yeah.
Well, what do you recommend usually?
Well, I'll tell you, I usually use a two-pronged approach in my practice. We always talk about that. Now, my practice is a natural, holistic type practice, but I think there is room for the flu shot. This year, we've done a better job. We don't always do a good job, but this year's flu vaccine, I'm here to say, is doing pretty darn well. So this is something I talk to patients about first. If that is not the case and then you end up coming down with something, then I kind of have a flu rescue kit in a sense when you feel like you're coming down with those symptoms. That's usually when you already have them.
Now, what difference does that make? Because once you've got it, I mean, is there really that much you can do?
Well, a little bit more than you think, a little bit more than we thought, especially on the natural holistic side. Like I said, I created a flu kind of survival kit for things that are natural that really can help you get better quicker.
So let's walk through that a bit and tell me what you've got. I mean,
sure.
There's one that's very familiar to me, the soup.
There you go. So we'll get to Campbell's soup at some point. Coming from the first one is a probiotic. Now, Chris, we all know probiotic is good for us. A lot of us don't know why, but we've heard a lot in the news. I'll tell you this, what we don't know is that when we get sick, you end up losing a lot of the good bacteria in your gut that's very important for your immune health. So therefore, using a probiotic to kind of replenish our gut with those things that help us fight are extremely important. There was a good study, which is great because we're here in Boston University area, but there was a study with college kids that showed that those that did take probiotic, 34% got better quicker. So there is some data behind that.
So one of the things that seems to be important here, though, is timing. I mean, you can't just think about this for 5 days.
Yeah, you're absolutely right. You need to be on it. The first time you're feeling a little fluey, I'd like to say, or feeling like you're not yourself, you have to jump on it. That's one thing for all of these that was very important.
What about the Oscillo, as it's known?
So yeah, Oscillo I like to call the best kept secret. You know, they've been using this in Europe for ages, it seems. It's a homeopathic remedy, and I love it because it uses the body's own immune system to heal itself. Also, good studies with Oscillo shows that it decreases the severity and the duration of illness, once again, when taken within the first 24 to 48 hours. Back to your point about the importance of really jumping on this. It's also good for kids 2 years and older, which is also wonderful because there were some years ago when we didn't know what to give our kids when they were sick. Remember, we were trying to figure out if this is good for them or bad for them, but Oscillo has a place for that.
I still have chicken soup, especially during the winter, and because I always think it warms you up, but I guess there's also something going on here about sort of slowing down the white blood cells.
Yeah.
I mean, what's that supposed to be?
Yeah, this just goes back to saying that mom is 100% right all of the time, okay? And she was right, but I don't think she knew that chicken noodle soup is almost like a medicine. It slows up the white blood cells' migration or movement to those areas that wreak havoc, such as to our lungs when we get that cough, or to our nasal passages when we get that pesky sneeze. So there are a lot of new studies with chicken noodle soup.
And you also have something here made of zinc or some compound there. What's going on with that?
Yeah, zinc is also extremely important. Zinc itself is a wonderful building block just for the immune system in general. So you can imagine, should you come down with something, zinc is the perfect thing to put together to really boost the immune system. So zinc has at least, 16 to 18 studies out there now that are really showing the benefits.
What about other things that people should do to either prevent the flu or make it easier to survive? I know the shots we've already talked about, but you know, I'm thinking of things that, stress levels, getting enough rest at night.
Yeah, and you've already hit a couple of the important things. The thing is, stress is a risk factor. Stress is a risk factor for not only cardiac disease, for just general health. Washing hands is something else that a lot of people say, Doc, washing my hands, does that really make a difference? I'm here to tell you, it makes a huge difference. We give ourselves these colds and these viruses. We rub our nose, we rub our eyes, sometimes we rub your mouth. and there you go. You've already kind of inoculated yourself. We're in these cities where there's a lot of people and transportation and those things, and you just never know when you've been touching someone and maybe contaminated yourself.
I know. I rode the train for years. I always stayed away from the person with the loud cough.
Yes, that's important as well. You have to, in the best politically correct way as you can, maybe go to the other seat or the other chair, that sort of thing. Carrying Purell and some of those other things that can kind of help you stay clean in public transportation. Extremely important, Chris.
The other thing is that once you've got something, you really do have to be thinking of other people, whether it means you're about to sneeze or if you're deciding that you really got to go to work no matter how bad you feel.
Yeah, 2 points. Number one, when you feel like you do need to sneeze, one thing you can do is you can always sneeze in your sleeve. Therefore, you're also not contaminating your hand and maybe something else at all. And the other thing is keep in mind your family members. Keep in mind your family members for two things. Number one, making sure that you are keeping your hands washed. Number two, that you're considering your flu vaccine. Should you have older people or kids in your home?
Yes, because for them it can be really, really serious.
Absolutely.
We should mention if people want to find out some more details here, Doctor, what's the best way to check that out?
Yeah, you can go to, I'm on Twitter at Dr. Redcross, Dr. Redcross, and my website is www.drredcross.com.
Thank you very much for being with us.
Thank you for having me, Chris.
Dr. Ken Redcross, and we'll have more news in just a moment.